Multiple myeloma is a type of bone cancer that has no cure, and it affects mostly men. Black men are more vulnerable to multiple myeloma. In this video, I'm going to discuss the causes of multiple myeloma. I'm going to explore what are the symptoms of multiple myeloma. I'm also going to talk about the diagnosis of multiple myeloma and what kind of care can you expect, or what kind of care should you get if you are diagnosed with multiple myeloma. So, what exactly is multiple myeloma? As I've said, multiple myeloma affects the immune system. We have what we call white blood cells, and white blood cells are responsible for producing what we call antibodies. They make antibodies that are used for fighting infections. Your body relies on white blood cells to protect itself against infection. For example, when a bacteria gets inside your body, it encounters white antibodies that are used to fight it until it gets out of the body. So in the case of multiple myeloma, there is an abnormal production of white blood cells. And these cells, when they proliferate, when they grow in very huge amounts and they grow out of proportion, they cause problems. The reason why multiple myeloma is called multiple myeloma, because it can start with the back, it can affect the back, the spine, it can affect your ribs, it can also affect your joints. The most common symptom is feeling joint pain. So what causes multiple myeloma? The exact cause of multiple myeloma is not known, but there's a strong correlation or relationship between multiple myeloma and several risk factors. And we are going to explore some of the risk factors that have been described or documented by researchers. So the first risk factor for this bone cancer is age. People over a certain age are more prone to getting this condition. Research shows that people who are above 60 years, 60 to 65 years, are more vulnerable to this type of bone cancer. So if you are in that age, or if you are nearing the age of 50, 60, you should consider preventive measures. You should consider scanning and so on. Early detection will help you prevent this condition from spreading. Another risk factor is gender. Male are more prone to this condition. This condition has been observed among men than women. Studies that have been conducted in developed countries like the United States show that people who are male are more likely to get this disease. The third risk factor is being black. If you are a black person, that's another risk factor. You are more likely to get this condition of multiple myeloma. Then if you have a family history, if somebody in your family, maybe your great-grandfather or your grandfather, had multiple myeloma, this disease can manifest in the younger generation. So family history is another factor. Then another very important factor is obesity. Obesity is a very important risk factor. This disease has been observed among people who are obese. So it's important to know that obesity is a risk factor. People who are obese are more vulnerable to getting multiple myeloma. Another risk factor is exposure to radiation. Radiation comes in different forms. We have people who are working in industries or environments that are exposing them to radiation. So it is important to be careful in your work environment. Being exposed to chemicals or radiation can lead to multiple myeloma. Then lastly, exposure to chemicals in the environment can also cause this type of cancer. Chemicals can be maybe agricultural. We have pesticides. We have indoor chemicals, manufacturing chemicals. They are all part of exposures that can make people contract this bone cancer. So let us now look at the symptoms. What are the symptoms of multiple myeloma? So the number one symptom is pain in the bones. Pain in the bones can be in form of back pain. It can be also in form of joint pain, pains in your legs, and so on. Another symptom is feeling of fatigue or weakness. There may be also the weight loss. Somebody may also experience weight loss and loss of appetite. A patient may also have what we call stomach upset. They may also experience constipation, confusion, and frequent infection. Frequent infections can arise because we've said that this condition affects the white blood cells. When the white blood cells are growing in an abnormal way, the immunity will definitely go down, and this is why you will be prone to many or repeated infections. Then you can also feel severe thirst, and you can also experience weaknesses or numbness in your arms and legs. So those are the symptoms. And now let us look at the diagnosis of this multiple myeloma condition. Now the first way that the condition is diagnosed is through laboratory tests. Blood tests can be conducted to detect the presence of calcium in your blood. The number of blood cells can also be counted. Complete blood count is one of the tests that can be conducted to detect to diagnose this disease. Then blood urea nitrogen or creatinine. These are tests that can be done to test the functioning of your kidneys. If your kidneys are working properly, this can be tested through blood urea nitrogen and creatinine test. Then we have other tests like the imaging tests, the scans. Ultrasound scans can be done also, whereby if you have problems with your bones, the imaging tests can be done. The imaging will show the malformations or damage to your joints that are causing the pain, and this can also be used to detect or diagnose the disease. Finally, I want to talk about the management and treatment of multiple myeloma. Research shows that there is no cure for multiple myeloma. However, there are medications that are used in managing pain. Once you are diagnosed with the multiple myeloma, you can be given pain management medications. Pain management is critical. people often have significant pain in the bones. So you have to learn how to manage your pain using antibiotics. Antibiotics are used for managing pain and infections that may arise in the course of this disease progression. Steroids are used and can also be used to kill the cancer cells, and they can also be used to reduce inflammation. Healthcare providers also recommend the use of chemotherapy. Chemotherapy is also used to reduce the number of abnormal plasma cells that are associated with this disease. Then we also have immunotherapy, a kind of therapy that is used to stimulate the immune system so that the immune system can develop more cancer fighting cells. The immune system can be stimulated to increase the number of cells that counter the cancer cells. So that is what we call the immunotherapy. Then we have the radiation therapy. These are kind of treatment that is used to kill the cancer cells with subjecting them to radiation, bombarding the cells with radiation so that they can be destroyed, and this can prevent the spread of that kind of abnormality to other organs. Then we have more other advanced interventions like stem cell transplants. Stem cells are specialized kind of cells in your bone marrow, and they can help to produce healthy new plasma cells. So health providers will often recommend stem cell transplants, which I think they are not cheap, they are very expensive, but they are a kind of intervention. So apart from those kind of conditions, our patients will require lifestyle modification, like the kind of foods you eat, the kind of activities that you engage in. You will be required to make modifications or changes in your lifestyle to help yourself manage this condition. A patient will also require education, patient education. You need to educate yourself. You need to seek the right education on how to diagnose this condition and how to the most appropriate treatment that you can use as a measure or as a way of managing this condition. So I think those are the main issues I wanted to cover. You can share if you find this information useful. You can support me. You can support my channel by subscribing. You can share the information with your loved ones. We need to do something so that we can prevent ourselves from getting this condition, especially black men or black people. You need to share this information because, as research shows, black people are vulnerable to this condition. So share this information, share it widely with your friends and relatives so that you can have a positive impact. Otherwise, thank you so much, and I'll see you in the next video.